Welcome along to Skin Changes and Acne Month. I'm chatting with Hannah Charman. Hannah, do you want to tell us who you are and what you do, and then we will talk about skin?
Yeah, so I work as a medical herbalist and health coach. So the way I deal with skin changes is to try and deal with the underlying causes of whatever's going on. Because skin problems, whether they're to do with perimenopause or anything else, are always an internal problem that's coming out in the skin. So it's not just a question of slapping a cream on or a lotion. You need to work at a much deeper level than that. So skin changes that I've seen in my patients around perimenopause could be anything from acne and boils right through to dry skin, or itching. So people get itching on the palms of their hands and soles of their feet, and they go off to the doctor and the doctor can't find anything and they don't know what to give them, and it can become a bit of a problem. So the nice thing with herbal medicine is we don't always necessarily have to understand exactly what's going on. We can still treat with the herbs. And I would generally give an internal mix of herbs. So there might be some in there that help to rebalance the hormones. There might be some specific skin tonics. There might be some circulatory tonics. And there will generally be a liver and kidney tonic in there as well, because very often our liver becomes overloaded and it's unable to do the processes it should be able to do, which then can affect the skin. So particularly itching, when we get itching in hands and feet, there's an issue with the liver there that needs attention. So we can do that. And also, as well as the internal mix, I would try and give something to put onto the skin as well. So if it's oily skin, we might give something with maybe an aloe vera juice base and put some tinctures in, or 1 or 2 essential oils. And then if it's dry skin, we can give oils, and I can also make up creams and lotions as well. There's various different ways that we can do that. And again, we just make the medicine up according to what the person needs at the time, and then we can change it accordingly. So that's a very potted, generic version of how I would deal with skin changes. But yeah, they can have a massive impact on mental health as well, actually.
Yeah, because, absolutely. And I think this is,
you used to have, yeah,
this is the thing, isn't it? We think of kind of acne and things as being a teenage problem, and then a lot of women start experiencing it again and feel like there's some sort of shame attached to it.
Yeah, well, it's like another adolescence, isn't it? Perimenopause. It's it's the women have got 3 life stages traditionally. So they used to say that we go through maiden, mother, and crone, which I think is a horrible word, because crone to me sounds like a bit too witchy. But it's just a natural transition. So we transition from maiden to mother stage in adolescence, and from mother to crone stage in perimenopause and menopause. So this is just a natural transition that we all go through. But yeah, we see it very differently now, and it's just your body's just recalibrating. It's nothing to be freaked out about. If you can just understand a little bit more about what's happening and get the help you need, it's much, much easier to deal with.
Absolutely. And I think that underpins so much of the message that sort of comes through in a lot of these interviews when I record them, is that perimenopause is kind of the time when it gives us a big shake and a slap around the face to go, look after yourself, rather than us constantly putting everyone else first. And obviously a lot of the symptoms, people think, oh, I'm just going to have to deal with it. But I think sometimes when it shows up on your skin, that's sometimes when people will actually go and seek help, because it's external to the world. The world can see that there's something different.
Yeah, and there's no hiding from it, is there? It's like there every time you look in the mirror, and people might even comment on it, which is delightful, isn't it? It's just what you want them to do. But yeah, there's no hiding from it. And I think you're quite right. Menopause calls on all of us to kind of step up the self-care and reevaluate what we've been doing. Some people go, well, I'm doing my best, and we're all doing our best. This is not anyone's fault. We're not blaming anyone for not eating right or not getting enough sleep. It's just the life we live these days is so hectic, that we're all a little bit up against it when it comes to looking after ourselves. Plus, we've possibly put family first and career first and all of that. And there comes a point where you just have to put yourself first, and it's now.
Yeah, so, absolutely. Yeah. Awesome. So would there be any just sort of one tiny tip that you might suggest to somebody who is just starting to experiencing sort of changes in their skin? Is there one tiny thing that's sort of a takeaway, or is it very personalized?
It is very personalised. Obviously, there's the basic stuff like making sure you stay well hydrated and drink plenty of water, eat plenty of fruit and veg because you need your antioxidants and you need your fibre and so on, just to keep everything running smoothly. But one thing that can crop up is that we can become more sensitive to our skincare products. But also, many skincare products that we use contain chemicals which disrupt our hormones. So I would say, if you can, to switch to sort of safe organic skincare without any chemicals in. There's a really good app called Think Dirty.
I was about to say that.
And it analyzes, yeah, the Think Dirty app is really good. So it will tell you exactly how safe your shampoo, your foundation, your shower gel, all of that stuff is. I'm a big fan of Neal's Yard Remedies myself, but there are so many other organic skincare products out there now. A lot of them are made sort of on a very small scale by sole traders, and it's really nice to support those people as well. So yeah, have a rummage around and see what you can find.
Awesome. Thank you so much, Hannah.
No problem. Cool.